Hello, family. It's KG Smooth, and I am back once again with our good folks at Aetna for their Aetna Black Health 365. July is Fibroid Awareness Month, and so we know that this is a serious epidemic in the community, especially for Black women. So, to talk about Uterine Fibroids and Fibroids Awareness Month, we have Dr. Miguel Fernandez, who is the regional chief medical officer for Aetna Better Health. How are you doing, sir?
Well, thank you. Good afternoon.
Good afternoon to you. So let's just jump right into it. Uterine fibroids, I hear a lot of my women friends talk about it amongst each other. I've had um, some women on my community affairs program, the Public Affairs Podcast, which this conversation will re-air, talking about uterine fibroids and the things that they go through. Some having to have hysterectomies, other kinds of procedures. So let's just start. Like, what are fibroids? What are uterine fibroids, and how common are they?
Yeah, so first of all, thank you very much for your time today. I really, as Women's Health Officer for CVS Aetna, and a board certified OBGYN, I'm very close to this subject. Uterine fibroids are very common. They're actually much more common than folks may think. Estimates suggest somewhere between 70 to 80% of women reproductive age have fibroids. And what they are muscle growth within or around the uterus or emanating from the uterus. For example, if you look at the uterus as a muscle, right? And fibroids is kind of, you look at the uterus as a muscle that almost may be like a plank of wood. And you see wood has knots in it, right? So that's what fibroids are. They're knots, they're swirls of muscle tissue that can either be inside the uterus on the lining, which creates certain issues around bleeding and whatnot, or they can be deep in the muscle themselves, or they can be on the outer lining of the uterus and even kind of on a stalk. That's what they are. They're proliferations of the muscle that makes up the uterus in ways that normally we don't see in a normal uterus.
And what causes these proliferations of the muscles?
Well, there's a lot of speculation as to what ultimately causes it, but
Speculation. Okay.
yeah, so we have a lot of theories, but ethnicity, race, genetics, we see that there's much higher predisposition for Black and brown women with fibroids. We also see that there is a genetic predisposition. For example, if you had a first degree relative, a mother or sister who had fibroids, you're probably more likely to get fibroids as well. Some hormones, specifically the ones that women produce, estrogen and progesterone, can lead to the development of fibroids. And then there's another category where what we call idiopathic, which we don't know for sure what causes them, but we just know that they're there. Even with normal hormone levels and no family disposition, non Black and brown folks still can get them. So that's that category where we're like, well, we're not exactly sure what causes it. We know things that contribute to it, but we don't have direct cause correlations.
That is very interesting. Does uterine fibroids affect the Black and brown community more than their counterparts?
Oh yeah, absolutely. Black and brown women experience higher rates of fibroids compared to the whites, and Black more than Hispanic and more than Asian. And a lot of that also is attached to the genetic predisposition, because oftentimes we see in the background of women with fibroids, they had a mom or a grandmother or an aunt that had fibroids as well. But yes, definitely it's higher prevalence in the Black community.
Wow, that's it's so unfortunate. Everything affects Black folks the most, the most all the time, and I don't understand it. How What are black and brown women, do you think, that are doing different than their white counterparts that it affects them more? I mean, could it be, is it diet? Could it be environmental? Um, Forever chemicals? Could it be, I personally, looking at it, doing a little research, could it be the hair straightening perms that black women use that causes fibroids? Like there has to be some sort of cultural um, difference as to why black and brown women get it more than their white
Yeah,
counterparts.
that's a great point. And the thing is that what you've mentioned are multiple contributors. We don't know, and we don't have any real strong evidence that any one of them are causative, if you will. Because if we did, we'd say, don't do this, and we should see the incidence go down, right? But we don't. So there is definitely, like I mentioned, family history. There is environmental factors, including, diet, obviously women with obesity, and we do tend to have a slightly higher rate of obesity in the black and brown population. That creates a heavier endogenous, internally produced hormone, levels that can feed fibroids. There's a lot of different theories as to what ultimately causes it, but we don't have any direct evidence that says this causes this. Therefore, we're always trying to, look at the global, preventative type of things that one can do in their lifestyle, which includes maintaining healthy weight, maintaining a healthy diet with higher fiber and vegetables and fruits, and reduction of processed foods and things like that. So, and then vitamin D levels also may reduce, and I stress the word may. It doesn't necessarily reduce, but it may.
Yeah, this
And if you're going to stack the deck, stack it on your side.
yeah, this is well, this is news to me that these uterine fibroids are also being considered hereditary. I mean, just growing up, I don't remember women going through that too much. I think I started hearing more about these fibroids like maybe the early mid 2000s, like around 2005, 6, 7 was when I'm hearing more cases of women having these issues with fibroids. So, what are some of the symptoms or and health impacts of uterine fibroids?
Well, there's a whole laundry list, right? Some women may not have any symptoms at all. The pelvis and the abdominal cavity are fairly large areas because that uterus, when it's pregnant, is accustomed to, taking up that space, housing a baby in the womb. So that area is already fairly spacious, if you will. So as a uterus grows with fibroids, some women may not experience any symptoms at all. Some women may experience pelvic pain or pelvic pressure. They depends on where the fibroids are and where they're located on the uterus, anterior wall, side wall, back wall. They could have impingement on their bladder or their bowels, so they could have issues with incontinence or urgency. They could have urinary problems. They could have back or leg pain because the uterus sits up against the back of the pelvis where the big nerves that feed the lower extremities come out. So they could have back or leg pain. Um, and obviously they could have symptoms like irregular bleeding. Sometimes could be very heavy, and they also could have issues affecting their fertility, the ability to get pregnant and maintain a pregnancy.
Mm, mm. I I'm sorry, ladies. This is wild times, and knowing what women go through when they have these issues. One being with you naming these symptoms, that pouch that they complain about in the front, or sort of like a fupa is what the ladies call it. And I know that with some of the women who I have talked to, that was the main thing that prompted them to really go and get everything checked out. Beyond the pain internally, there was this bump or this hump in the front that they could not get rid of. What causes that?
Well, there's several reasons. One, you have to distinguish if indeed is not just fatty tissue from, from gaining weight, or if it truly is something coming from inside the abdomen and pelvis. As the uterus grows with fibroids, you can imagine you have the body of the muscle, and then you have these knots, if you will, attached to it or coming from the inside. The ultimate effect of that is it causes the uterus to be larger. And as it gets larger, it starts to rise up out of the pelvis. And then women feel this pressure and this bulge, if you will. Uterine fibroids can manifest themselves in anything from very small ones, the size of the pea, to the size of basketballs. And women who have these
Basketballs.
start to notice that something is different here, something is growing, much like what they felt like when they were carrying a baby, because fibroids can cause uteruses to grow to 3 4 months 6-month pregnancy size. And and in those situations they create all kinds of pressure, pain, bleeding, and other issues that seek women to that cause them to seek treatment and care.
Mm. To everyone listening and watching, I'm KG Smooth. We are talking to Dr. Miguel Fernandez with Aetna's Black Health 365. It's Fibroid Awareness Month. Dr. Fernandez is the Regional Chief Medical Officer at Aetna Better Health. So, what are the treatment options for fibroids? Because doctor, I've got to be real with you. Like, the science community needs to get on their job is to see why this is happening to Black and brown women more than their white counterparts. It just all of these years of research and money put into that, and they don't know like the main cause. There's something doesn't sound right here, um, and that's with a lot of ailments that plague the Black community. But we'll talk about that next time. But the treatment options for women with fibroids, what options do they have?
Well, the treatment options, thankfully, over the years, has been a lot of advancement in treatment of fibroids. In the old days, it used to be surgical hysterectomy, which is a major abdominal procedure to remove the uterus and therefore remove the fibroids. You can imagine the fact that it is a major abdominal procedure. There are risk of complications and bleeding, infection, damage to internal organs, et cetera, et cetera. Not something that should be taken lightly, but it also is a procedure that results in permanent loss of fertility and longer recovery times. With the advent of laparoscopic surgery and then followed by robotic assisted laparoscopic surgery, these procedures have gotten a lot better, a lot easier to perform with a lot less complications, but it's still considered a major abdominal surgery and should not be done as the first treatment option. It should be done, as a last resort. So for women who have large fibroids, most of the time surgery is what's going to ultimately be indicated. But for women who have marginal size, moderate to smaller fibroids, there are other treatments. For example, there's uterine artery ablation, where they go in through the sort of like a cardiac cath. They go in and find the uterine artery and actually occlude it so that the fibroids lose their blood supply and therefore they shrink. There are complications to that one because the uterus is a muscle, not dissimilar to your heart muscle. You cut off blood supply to your heart muscle, you get an infarction, a heart attack. And that same process occurs with any muscle in the body. So if you lose blood supply, then yeah, the fibroids will shrink, but it may be a situation for certain patients that creates a lot of pain. And sometimes that pain is severe enough that they end up going back into the hospital and getting a hysterectomy anyway. But now more recently, there are more medical treatments that are coming out. There are drugs that are hormone releasing factor inhibitors, right? Our body makes hormones, estrogen and progesterone, and the estrogen kind of acts as fertilizer for these fibroids. And that's why women in their reproductive age are the ones that seem to have fibroids the most. And when they go through the change of life into menopause, the fibroids tend to shrink because naturally that estrogen source has diminished or gone away. So during a person's reproductive life, if they have fibroids that are symptomatic, they can be treated with some of these medications to shrink the fibroids, and sometimes shrink them enough so that surgery becomes less risky if they need it, or sometimes it's shrinks them enough that it gets rid of their discomfort. Doesn't necessarily get rid of the fibroid itself, but it gets rid of the symptoms that they're struggling with as a result of the fibroid.
I I hear you, Doc, but it just in my mind it just doesn't make sense. Like we can get rid of the symptom, but we can't get rid of the fibroid itself. It reminds me of when I'm interviewing an infectious disease doctor, and they're explaining HIV and how some person on the medication, how the medication can get the viral load so low that it is undetectable, but yet the virus is there, and I'm just like, well, if you can get the virus that low as to where you can't detect it if you get tested, then how come you just can't eliminate it? Like these things don't add up in my mind. But I'm not a doctor. I'm just an observer. And man, women have got it really bad with this whole situation. So what can women do to even manage their risk of fibroids?
Yeah, so a few things women can do. Number one, you can't, get rid of your genetics, right? That's not something that you have any control over, but you can manage your weight, your activity, the foods that you consume, high fiber, low saturated fats, those types of things that lend themselves to obesity, things that in today's society are hard to cut out because, let's face it, they taste good. And it's hard to cut those out. So we're not suggesting that women, just make a life out of eating salad and tree bark, but diets that are high in fruits and vegetables, regular exercise, maintaining healthy weight, keeping your vitamin D levels in check are all helpful. But I stress again, as I did before, those may reduce the risk, but they are not a foolproof that says if you do this, you won't get fibroids. That's just not the physiology or the biology of this condition.
Oh, yeah. Well, let's end it on a positive note. Can you give some recommendation methods um, for diagnosing fibroids, or what are these methods
Yeah,
for
so I think the
diagnosing?
most important thing that women can do is familiarize themselves with their body, right? And make sure you're getting regular checkups at your doctor's office, making sure you're keeping track with your OBGYN visits, all those preventative care things, which includes screening, evaluation, counseling, immunizations based on your age and risk factors, and then maintaining, as best you can, a healthy diet and a healthy activity level. But I think being aware of what's changing, or if you feel something changing, even the slightest amount of pressure, irregular bleeding that shouldn't be happening, these are all things that you can tell your provider about, and you can get evaluations and earlier diagnosis that will reduce the symptoms, reduce the aggressiveness of therapies, and hopefully be able to allow women to live a much healthier, happier life, knowing that once they hit menopause, naturally, these fibroids should shrink. And look, I'm going to tell you, as a practicing OBGYN that practiced for 20 years with my wife, who's also an OBGYN, and being a women's health specialist, women, yeah, they have it tough. And if we let's not kid ourselves, they are by far the strongest sex, of the males and females.
Absolutely,
They
without a
deal
doubt,
with things that we would never be able to deal with. And
without a doubt.
this is just one of those things that tends to arise if you're cognizant of your body and you are self-aware of your body. You can identify early changes that can be investigated and diagnosed and treated with minimal discomfort and disruption in your life. But it all starts with that self-awareness, and it also starts with making sure that you're doing the other things to reduce your risk that we've talked about already.
Indeed. And does Aetna Better Health or CVS Health offer any resources for fibroid care?
Oh yes, absolutely. We offer a bevy of resources, everything from our in-network providers. We offer other services like minute clinic locations, virtual visits, access to women's health services. We have some great partnerships with some vendors that can provide women's health services, and in the minute clinics and and the like, they can get pelvic exams, they can get evaluations of their menstrual symptoms or dysfunction, and get referrals for ultrasound imaging or MRI if necessary. So there's no shortage of resources available. And again, through self-awareness, through proper diet and exercise, and early detection through these types of interventions, minute clinic, et cetera, and your provider's office, we should be able to find these things well in advance. And finding them well in advance equals less aggressive therapy and a healthier, happier life living with a condition like fibroids.
Wow. Well, thank you so much. You all can download the Aetna Health app or visit the Aetna member website to find your in-network OBGYN, or you can also go to cvshealth.com for more information. Dr. Miguel Fernandez, the regional chief medical officer at Aetna Better Health, thank you for coming on and sharing your scholarship with us.
Thank you so much. It was a pleasure spending time with you, and I hope that your audience has gotten something positive from this, and understand that we at Aetna CVS are here to help, and we will provide all kinds of services and access to care for women.
Indeed, indeed. Thank you, everyone, for listening. This is Black Health 365 Extended Conversations powered by Aetna, and I'm KG Smooth, and I'll see you on the radio.